Time once again for a look at what's making headlines in the field of heart health. Joining me in studio is Mark Ottens, the Director of Emergency and Pediatric Services at Baptist Memphis. And Mark is here to discuss cooling therapy, a different type of emergency treatment for people suffering cardiac arrest. And welcome to Smart Medicine.
Thank you.
Heart of the matter here. Well, let's talk about this cooling therapy. What is it?
Well, cooling therapy is a way for us to treat patients who have suffered a cardiac arrest and have lost their pulse and then regained the pulse. Only about a fifth to a third of patients actually get a pulse back when we do CPR, and a large percentage of those patients are never able to return to normal functioning afterwards because they have brain damage and they're comatose as a result of loss of oxygenation and blood flow to the brain. Cooling therapy allows us to treat those patients with a therapy that previously wasn't available to us to help save that brain function.
So what are some of the benefits?
Well, the benefits are that we can take that patient and we can cool them down to 92 degrees, keep it very, very controlled, and it stops the swelling that occurs in the brain after a cardiac arrest. That allows those patients to recover. We have seen some studies have shown as great as 50% of those patients at 6 months out after their arrest have been able to return to some normal function.
Well, how does this differ from current cardio technology already available?
Well, the current technology that's out there has allowed us to put defibrillators out in the field. It's allowed us to have the AED, which you may see in your McDonald's or your at the airport. There's an AED, and the technology is out there for rapid use for CPR, and it does help get patients' pulse back. What it doesn't do is help us then resuscitate the brain after we get a pulse back.
And that is significant.
Yes.
How cold are patients really getting in this cooling therapy? Are we talking about deep freeze?
It's not a deep freeze. It's a very controlled drop of their temperature down to 92 degrees Fahrenheit. We'll start some cold saline, start the temperature to drop as for their core temperature. Then we put a device on that helps us control their temperature at 92 degrees Fahrenheit. We hold them there for 24 hours. Once they've been at target temperature of 92 degrees Fahrenheit for 24 hours, we slowly rewarm them for 24 hours. It's shown such great markedly increases in positive outcomes for patients that it's really becoming more of a standard therapy now. And we've had it in place now for about a year.
And I know it's been effective.
It has. We have cooled several dozen patients at Baptist Memphis. We have seen patients who originally we didn't think would wake up after their cardiac arrest to wake up, follow commands, and have some great improvement. The really telltale signs of how much improvement they get comes 6 months afterwards. And so we have to follow those patients to watch and see how much improvement they actually get at 6 months out.
Well, Mark Ottens, thank you so much. Director of Emergency and Pediatric Services at Baptist Memphis. Thank you for being with us today here on Smart Medicine.
Thank you.